Welcome to the Perspectives on Healthcare podcast, where members of the medical community from different roles, venues, and locations share their unique perspectives on quality healthcare, its future, and how to improve it. Now, from the Your Keynote Speaker studio in Pittsburgh, Pennsylvania, here is your host, Rob Oliver.
Thank you and welcome. Today, my perspective comes from Sam Rhee. He is a plastic surgeon and a CrossFit enthusiast who lives in northern New Jersey. He is a member of Generation X. And Sam, welcome to the show.
Thank you. It's an honor to be here.
Absolutely. So we'll start right from the beginning, and tell me a little bit about yourself and your role in healthcare.
Thanks. So I am a plastic surgeon. I've been board certified for 16 years at this point. I've sort of seen healthcare on a couple different sides. When I first started as a plastic surgeon, I worked in a large institution. So my first job was at University Hospital in Newark, New Jersey. And I saw a very, I guess you could say, urban, gritty part of what healthcare is about. I saw a lot of trauma. It was very eye-opening as a young surgeon to be exposed to that. And I did a lot of craniofacial care. So I trained originally as a pediatric plastic surgeon, did cleft lips, facial trauma, anything sort of related to children and the head for the most part. And I worked in large teams. So most of those types of care required, geneticists, neurosurgeons, ENT specialists, pediatricians. After a couple of years working there, I worked at New York Presbyterian, pretty much in the same role, but this time in Manhattan. So it was a little bit of a different demographic for sure. And I was there for another couple of years. And at that point, personally, I loved this type of medicine and this type of care. But if you want to be in that intense academic setting, you really have to spend a lot of time there. And I was living in New Jersey, in northern New Jersey, and the commute, I had two young kids and I had to make some choices. And I ended up leaving and then switching pretty dramatically into a single solo practice environment. And, once you leave that large academic or institutional environment, you can't really do the same types of surgery. And most plastic surgeons who are in single practice environments end up doing primarily cosmetic surgery, which is what I basically transitioned into. So for the past, 9 years or so, I've been doing primarily liposuction, whatever stereotypical things you might expect a plastic surgeon to do on TV, facelifts, breast augmentations, liposuction. So I've seen it from multiple aspects.
Okay. And I'm just interested to hear just a little bit more about your take. When you're in the big hospital, it's a team setting. Are you able to generate any type of team setting as a solo practitioner, or is it just kind of you on your own? What would you classify as kind of the difference between those two opportunities with team building?
So when you're in a large academic institution, you have resources provided for you. You have very smart people all working in their specialties. So you have a pediatric ophthalmologist, but a really, really, top of the line pediatric ophthalmologist. You have geneticists who are working at the forefront of their field. And so when you meet about these very complicated patients with complicated issues, you can sort of put that together. And you have institutional funding typically to do that. They want you to, if they're an elite institution, they want to perform elite level care. When you're in your own private practice, you're no longer salaried by the hospital. You're now based on your own revenue that you make. And most of these procedures are, although they're very complicated, they don't reimburse well. We're at the mercies of insurance. And, when I first came out to northern New Jersey, I did try to work in that setting, but it's, it's without some sort of infrastructure, it's really difficult.
Got it. What does quality healthcare mean to you?
Yeah, that's a good question. So thinking about this, I pulled what a traditional definition is, and I wanted to pull some aspects out of that. So, the definition often used, and we see this in hospitals all the time, is quality healthcare is safe, it's effective, it's patient-centered, it's timely, it's efficient, it's equitable. Well, for me as a plastic surgeon, especially when I was performing a lot of reconstructive care, I usually would see patients. Well, our specialty usually sees patients in a couple different settings. We'll see them in the ER for acute trauma, either complicated soft tissue lacerations or facial fractures, or we will often work with other specialties such as orthopedics for other reconstructions like limb reconstruction or hardware revisions, or we'll work with a surgical oncologist for reconstruction of the breast after mastectomies. So in most of these situations, the one aspect of quality healthcare that stands out is patient-centered, because we are surgeons. We are very focused on, our techniques are generally safe and effective and timely and efficient and equitable for the most part. Those are not the decisions we're making as clinicians, but each patient in these situations is very unique. Whether you're working with a 17-year-old or a 77-year-old or 50-year-old mother of two versus a father who is 25. Like, these are all different situations, and how you tailor your treatment plan for that patient entails a great understanding of what that patient's situation, their needs, their goals are, and and that's what we take pride as in plastic surgery is, if a patient has a blocked artery, there's really like one treatment for it, right? But when a patient is absent a breast, or if they have a hand laceration, are they a workman? Do they work with their hands? Is it their left hand? Which finger is it? What type of goals are these patients seeking in terms of their function versus aesthetics afterwards? And so I think for us as plastic surgeons, quality healthcare depends on patient-centered care.
Well said. Can you give me an example of quality healthcare?
Yes, I think one of the ones that touches most patients, and I don't do this anymore, but I did, was breast reconstruction. So, 1 in 9 women will eventually be diagnosed with breast cancer. It's one of our most prevalent care issues in America and around the world. And when a patient undergoes a mastectomy, where they are removing a breast for breast cancer, there are many, many reconstructive options. And it is certainly not cookie cutter, and not one option fits all. It can range from no reconstruction, which has been an option for patients, and there's a vocal subset of patients who believe in that, all the way up to very, very complicated multi-step microsurgical reconstructions, and everything in between, implant reconstructions or a combination of such. And each option has a range of sub-options. So when you talk to patients and you put them in a situation, a great plastic surgeon will be able to honestly offer all of these options fairly to a patient, who can then decide for themselves what it is that they want. And it can be overwhelming, almost too overwhelming. And so a big part of quality healthcare in that example is being able to present this to a patient in an easily understandable, digestible way, which helps them decide what they want to do. And that's a tough thing to do. The best breast care plastic surgeons that I know are not just technically great, but they're really good at connecting with patients and helping them, guide them through all of their options.
Yeah, there is an element of medical knowledge, but then there's also the communication intelligence to be able to talk about it and bring folks onto that page. What do you wish people understood about your role in healthcare, about being a plastic surgeon?
Wow. Well, it's sad to say, but I'm really no longer, I can't really call myself a healthcare provider right now at this time. If I'm doing primarily aesthetic procedures, I'm not really performing healthcare because these are not needed procedures per se. But I will say, in my experience, I've seen both, like I said, large institutional as well as small single surgeon type situations. And I would say that improved health and positive outcomes go hand in hand. I think the farther along I've gone, the more I see that. I think it's really hard for us as surgeons not to focus on a specific issue. And I think for many, many years I did that. I focused at the issue at hand and I would try to help manage that issue at hand. But I think what's even more important now is for our, and this is something we've espoused for many years, but it's really hard to implement, holistic care, where we truly understand what our patients need, not just from what they need today or next week from us, but what do they need in general. And I think that's in part why I became a CrossFit coach, is because, I had been interested in what is involved in making patients healthy, not just fixing problems that they had. And that can be as simple as exercise, or it can involve nutrition. It can involve other aspects of patients' lives, like stress or management of stress. And I think the farther along I've gone, I see how, as healthcare providers, we could probably work a lot more on that aspect of things.
Okay, so I would just want to kind of parse through what you said there, because you gave me two impressions. Okay, one said, like, I'm not delivering healthcare per se, and then the other is to look at people holistically. And in some ways, I'm thinking even when it comes to cosmetic surgery, you are changing the way that people look at themselves or feel about themselves, which is a self-image concept that changes their psyche, and in that way is kind of peripherally linked to healthcare, because it's looking at them not just as body, but as like mind, body, soul kind of thing, and it's more holistic. What's your reaction to that thought?
I would appreciate that, because that puts a very positive spin on what I do, and I like that. I would say that's been a process for me, especially as I've come along. I have to say, when I first started in cosmetic surgery, you want to build your business, you want to make money, and so definitely at first it was listening, like, what do I think the patient wants? Can I fulfill that technically? And then achieve that, regardless of what the overall improvement in that patient's life is. At this point in my career, I definitely do think about whether or not this will affect a positive change in the patient's outcome, because that makes me happy. But I have the luxury at this point of being in practice for long enough that I can work with my patients. I don't have to honestly take every patient in the door. I actually counsel patients a lot more now about not necessarily doing surgery at this point. For example, I will have a lot of patients for body contouring. And if I see a patient and they're 5'3" and 270 pounds, well, what I can do cosmetically is not going to impact them very much, nor will it effectively impact their self-image much, other than very temporarily. So I really work with those patients. I never say no to anyone, but I do say, for us to really get to the point where I think you want to be, these are some of the things that need to happen. And I'm willing to, I'm not a weight management specialist, I'm not a nutritionist, I'm not a psychologist, but there are resources that can help. And I'm here to support. And if at some point you get to that point where you are a candidate, then absolutely, we can do some things for you. And I have had a couple amazing success stories with patients where they really took that to heart. They got super motivated and they really made positive changes. I mean, of course, change is really uncomfortable, and not a lot of people necessarily will do that, but at least it starts to put the thought into their head, and maybe not this year, but maybe next year or the year after, they'll think about some of these things, and maybe they will affect some change in their life. So those are the kind of things that, yes, you're right. There are some oblique aspects to improving healthcare that I might be involved in.
There you go. So, and to get back to what you talked about earlier on, that is the team building concept, in which it's like, I'm not the only solution. There are other resources. Let's work out to see what works best for the patient. So, what excites you about the future of healthcare?
Ooh, what excites me in a positive or in a concerned manner? Because there's a lot on the concern side, but there is probably some stuff on the positive side too.
So, yeah, we can take both of them.
So I think a lot of people have concerns about healthcare in the future, and there's no doubt there are a lot of issues. I think the biggest thing that I've seen is how the financial aspects of healthcare are increasingly front and center. And I see that obliquely in how things are in the healthcare landscape. I see hospitals merging and very large groups of hospitals merging to the point where they are being blocked for antitrust violations, for monopoly creation. And these are sort of things that you never saw hospitals do before. This is what big business used to be cited for. And so it's really unusual that this is happening, but it's happening because people are looking at healthcare financially as a commodity. I have had my colleagues had their practices bought out by venture capitalists, and they are purchasing large groups of specialty practices in order to try to consolidate and get a hold on a market. For example, dermatology in our area, there's are larger and larger groups being consolidated, and I think that these are the consequences of these. The financial aspects of healthcare have not been fully understood, and I don't think anyone really knows what's going to happen in the future in this regard. I think everyone thinks bigger is better, but as we all know, the deeper you get into the system, the less personal responsibility people have, the more the system takes over, so to speak. The really difficult it is to find quality healthcare in those situations. Oftentimes you just get really, really lost, and it's very frustrating. So that's probably one of the concerned excitements I have.
Got it. I live here in Pittsburgh, and we have UPMC, which is the healthcare system that seems to have just taken over and is growing exponentially. So yeah, and were you gonna share something that excites you positively?
Well, I think the thing that that heartens me is that individuals still matter within healthcare. I think if you're a provider and you care, that's why you're going into healthcare. I don't think, and I talk to young people all the time, they should not be getting into healthcare unless they really care about caring for others. And I think that that's really important. And I think as long as we have people for which that is the driving and motivating factor, no matter what we do in healthcare in the future, that sense of dedication to others, the service for others, is going to save us as a system and as a specialty.
And it is the care part of healthcare that you're saying is kind of the essential nature of what it is.
Absolutely.
What is one thing medical professionals can start doing today to improve the quality of healthcare?
It's always personal responsibility. I would have to say it's very challenging sometimes when you're working within a system to feel like you have personal responsibility. Time and time again, I've seen ICU nurses. They certainly care about their patients. There are some that are amazing superheroes, and yet the system tends to, I don't want to say break you down, but it gets so challenging, the way they set up work hours, or the way they set up staffing, or the way they set up other issues. And as a provider, you can often feel like what you do doesn't make a difference, or it breaks you down to the point where you're burnt out. And so I would encourage us to find ways to look above it. And unfortunately, that often means not necessarily doing focusing on what you've been trained to do, which is to provide quality healthcare, but to look into influencing management or becoming management or taking a leadership responsibility on some level. Even though I'm no longer, doing reconstructive surgery, I do serve as chair of the credentials committee, and I'm associate director of plastic surgery at Valley Hospital, the local hospital in our area in Ridgewood. And, this is not for any reason other than I want my hospital to provide the best possible care, to evaluate our providers in the best possible manner. And it's for no other reason than to try to say we as physicians do have a role in management and also in trying to make sure that the stuff that comes down from top is truly patient-centered. And so oftentimes I think the physicians on these, we hate to be on committees. We hate to be part of these types of, time-consuming processes. But I really applaud anyone who is involved on that level, helping to create policy, helping to, figure out how to make the best systems-based practice for patients. And that's where we as advocates have to step above ourselves, take our personal responsibility, and to do those things we hate to do, but that ultimately make such an important impact on all our patients.
A very powerful way to end our interview. Sam Rhee, thank you so much for being here. I appreciate your perspective on healthcare.
Thanks for listening to Perspectives on Healthcare. Visit perspectivesonhealthcare.com to learn more about Rob Oliver or to subscribe so you never miss an episode. If this podcast was valuable, we'd appreciate a review on iTunes. Or if you tell a friend or coworker about the show, that would be helpful too. Join us again next time for more Perspectives on Healthcare.